Okay, so today I'm going to be injecting Juvederm Ultra, Ultra XC actually. The XC formulation also has lidocaine within it, so it makes it a lot more comfortable to inject. When it comes to lip augmentation, Juvederm is really my filler of choice. I think while other fillers can give a nice natural result, I think Juvederm, in some ways I do prefer the really natural look that it can provide. I really like the fact that it sort of plumps the lips in a really natural way. Juvederm, a lot of patients will ask how long does it last. I think for most patients, Juvederm, I tell most patients expect 4 to 6 months in the lips. There's a lot of movement in that area. It depends on the patient's metabolism as well, how fast do they metabolize and eliminate the product. But in general, I think most patients should expect around 4 to 6 months, and some patients can expect even up to a year at times. Again, this is a hyaluronic acid product. Hyaluronic acids are great because there's essentially no risk of allergic reaction. It's very natural. We already have it in our bodies, and so it's really an ideal filler in many ways. So with this Juvederm Ultra, with that being said, today I have a patient for lip augmentation, and for her I'm going to be injecting the vermilion border, and that's going to be the area that sort of surrounds the lips, just for more lip definition, and then injecting also into the lip body itself. Again, I really like the XC formulation. I think you can inject a lot. There's, even if you've done some topical numbing with this, it's a lot more comfortable. Patients might still feel some pinching, but in general, it's a lot more comfortable when you do it this way. The needles that come with the Juvederm are 30 gauge needles. They're 1/2 inch, so it's a very small needle that's used. So the Juvederm, after I've got the needle ready, what I'll do is make sure. So I'm going to have you lay back just a little bit here. Yeah. And that's going to make you just a little bit, I want to get you in a very comfortable position. I'll go fairly slowly, and if there's any areas, sometimes the lips they're vascular, and if there's a little bit of bleeding, which sometimes there may be a small amount of bleeding here and there, I explain that to patients, then I'll just stop along the way too if I need to stop that. But I go pretty slowly with this. So you just stay comfortable here, and I'll do a little bit of injecting. Great. How was that?
It wasn't bad at all.
Wonderful, wonderful.
Better than I've ever had.
Excellent. Okay, so I'll keep marching forward. It might get a little more sensitive towards the middle of the lips, so.
Mm-hmm.
Yeah, a little bit. Good. You can really see that lip come up already. I mean, it's very nice when it defines a little bit there. I apologize. Good. And essentially no bleeding. Okay, so for this side, same thing. Find the vermilion. Great. Again, I kind of just put a little bit at a time, thread it in there. A little pinch here. Beautiful. Great, not bleeding at all. That's wonderful. So now I can see I've sort of defined it, and I really, when I put it in, I want it to not, fill in this side, the white side, but the pink side right here, the red side of the lip. That's the side, and that's what we want to define. If it's incorrectly placed up here, it's going to create this kind of whitish roll to it that I don't think is nice. Okay. I'll defer on you probably not even putting anything in the middle, and that's going to help kind of push this together, especially once we fill in the body of the lip. Now I'm going to do the lower lip here. Open your mouth just a bit. There we go. Good. bit, I know. Great. See, that lower lip is just so key. Close enough for me? Yeah, it looks awesome. Yeah. Yeah. Okay, just a little bit I'm going to put in this vermilion. Let me look real quick here. Looks pretty darn symmetric, actually. Just a little bit more on this side here.